Today I am reading from the book Spirit of Homeopathy, book written by Dr.Rajan Sankaran, Mind section, chapter number 31, Heart of Case Taking, part 4. Under label, the homeopath as an archaeologist. Many a time the homeopath has to do the job of the archaeologist, who often find the original structure covered by the layer of earth, so that its true shape is totally occluded. In a chronic cases, what the situation and pathology have added to the central disturbance is like a earth accumulated on the monument. Just like the archaeologist, the job of the homeopath is to separate what has accumulated from what is original so that the true identity of the structure become clear. When he begins his search, he does not know what is going to emerge. He just has to keep separate the false from the true. This has to be done very carefully. One must not remove part of the original monument itself in a process, nor should one be too cautious and not remove all the earth that accumulated. In case taking, this would mean that we are not try and explain away something on the basis of situation and pathology, which may be part of the original disease. An expert archaeologist may be able to make a good guess about the identity of the structure even after uncovering the small part of it. Initially, observation or the symptoms may give a clue to the remedy, but the good homeopath will examine all aspects and elicit the whole picture clearly before he decides on his prescription. Now, on the label, all features of the remedy need not to be found in every case. There are two very important lessons that we can learn from the archaeologist. The first is that archaeologists will rarely find all pieces of the monument in one excavation. Whatever pieces he does find, he has to discover the type of monument in which they all fit. In terms of case taking, this means that we do not often find all the characteristics of the remedy in any one patient. We have to study all that we do not find and see which remedy this fits into. Now on the label, all the characteristics of the patient must fit into the remedy selected. The second and most important lesson is that although the archaeologist does not expect to find all the pieces of the monument in the excavation, he does expect all the pieces he has found to fit into one type of monument. Even if he finds one or two pieces that do not fit, he must seriously suspect his original conclusion. For example, he may find pillars and demands so that think that the monument could be church, but he finds along with this a butcher's knife. Then he has to doubt his original judgment and try to find a type of building in which everything he has uncovered could be fit. In terms of case taking, this means that we do not expect all the characteristics of the remedy to exist in patient. For example, we can have a calcarea patient without a fear or the desire of eggs, and absence of these symptoms does not rule out this remedy. Yet, whatever characteristic symptoms in the patient we do find must fit in the remedy. In the case where all the other symptoms may fit the calcarea, but the patient has a very prominent symptom like audacity or courageousness, which is not covered by the remedy. This would rule it out. In short, we are not to discard the remedy if the symptoms of the remedy are not found in the patient. We have to discard only if the characteristic symptoms of the patients are not found in the remedy. This point is worth stressing again and again because unconsciously we expect some definite symptom of the remedy to be found in every case of that remedy. For example, if patient is to be a pulsatilla, we expect her to mild, weeping and thirstless. We all speak of remedy in this manner. For example, we say lycopodium is a coward and natramur is dwell on a past disagreeable occurrence. When we make this kind of statement, it is like saying that we would rule out this remedy if that features were not present. We must not fall into this trap. Remedies are combination of several traits. It is not the mandatory that all traits be present prominently in all cases. It is not for us to see whether our picture of remedy will fit or match all the patient's characteristics. If they fit well into one remedy, we have to give the remedy even if our favorite symptom of that remedy are missing in the patient. Now under label case uncovering. The plan of case taking that I adopt is one that allows the patient to allow the picture to emerge spontaneously and clearly. Thus, case taking is neither an active or nor a passive process. I feel both the term case taking and case receiving are not suitable. Actually, it should be called the case uncovering and case discovering. Again, Herriman surpassed us all when he uses the expression tracing the picture. Now, under label tracing the background. I therefore usually begin by asking the patient to tell everything concerning his background. When he does so, it is necessary to observe him constantly. His every gesture, movement, his attitude and manner of talking. The initial questions are directed at finding out where he came from, who his parents are, what his occupation is, what is the story of his life is, what is the situation regarding education, marriage, money matters, and what are his interests against the background. I try to search for things which are peculiar to him. At each point, it is necessary to carefully discover whether what he is describing is common or uncommon to his background, and how intense and striking it is. The kind of informal talk, even before we have asked about his chief complaint, brings out the imperceptible and unconsciously most of the feature of his mind, and slowly details emerge of the way he thinks and feels. Now under label, obtain confirmation of your impression. The impressions we thus gather have to be confirmed not once but several times in several situations before we can rely on them for finding the remedy. If we are climbing a steep, high mountain, our foothold has to be very strong and firm, and we have to check it not once but 3 or 4 times before we can put our whole weight on it. If the foothold is not secure and we do not make sure that it before we put our entire weight on it, then one wrong step may take us hurting down the mountain. We have therefore to be very sure of the symptom on which we are going to rely. I am emphasizing this because earlier when I found something which sounded characteristic, I was too scared to get it confirmed, as I was afraid I may lose it, and so I defended that symptom with all my life, not allowing even the patient to change or withdraw it. Symptoms which needs to be guarded so heavily is not worth the effort. Let the symptom be heavily exposed, and in fact put them through water and fire before you accept them. Attack the idea yourself. Be very special, confirm in other situations, and be very sure before you learn on it for support.